Hello and welcome. I'm Brian Lane, and the President and CEO of WellLink, formerly known as the Center for Health Affairs, the Cleveland Hospital Association. Today, we're diving into some of the most critical issues shaping the future of healthcare, from artificial intelligence and regulatory compliance to cyber risk and ransomware, which are all the headlines, right? At WellLink, we're committed to improving the health and well-being of our communities, not only through innovation in healthcare, but also investing in the people who power it. And that's why we're proud to partner with ecfirst, a leader in cybersecurity, compliance, artificial intelligence, and just training and education overall. Through this collaboration, we're working together to strengthen healthcare systems and expand access to education and career pathways in these fast-growing fields, especially right here in Northeast Ohio. To help us explore the challenges and opportunities ahead, I'm joined by my dear friend for over 20 plus years, Ali Pabrai. Love you very, very much. CEO of ecfirst and a globally recognized expert in AI risk management, HIPAA compliance, as well as cyber resilience. Let me just say this, folks. If there's an expert within the nation that you have not tapped into, this is the guy. Because if you had tapped into him, you would already know and be calling on him each and every single day, because we all are suffering from cyber issues. And this cat knows more about it than any one of us. So in this conversation, we're going to be diving into three main areas, Ali. The first one, the current state of AI risk management in healthcare. Why? Because AI is used in every sentence of the business of vernacular at present time. Number two, going beyond HIPAA compliance. What's on the horizon, right? Also, is HIPAA the same as the piece that we worked on before, a few decades ago, or I should say a couple of decades ago? Number three, preparing for the realities of cyber threats and ransomware disruption. Many organizations out there, Ali, are getting tapped for ransomware and being told that they've got to shut down. And there's a lot of disruption associated with it, not from just a financial standpoint, but from an operational perspective. Love your insights on that. So let me just say this to you, my friend. Thank you for joining me today. And I'm really excited about this conversation. It's very reminiscent, as you and I were saying in preparation of it, of 20 plus years ago, when we would do this on a regular basis. And here we are again. And guess what? I think a lot of the stuff that you and I used to predict has now come completely forward and actually happened. And it's becoming even more intensified with even greater risks than we ever foretold. So
really excited, Brian. First of all, thank you so much. It's always exciting collaborating with you, and WellLink at the crossroads of wellness, and everything that you're doing sparked with innovation. And I think when you think about add AI to that, it's going to accelerate everything. So looking forward to this conversation.
Me too. And I've got a whole host of questions for you. I hope I don't talk your ear off too much with them. We do have a good bit of time together. But let's start off first with our state of AI risk management, if that's okay.
Yep, absolutely.
Okay, so to set the overall stage, Ali, why don't you begin by talking a little bit about where we're currently seeing the impact of AI in healthcare, as well as like the areas that you are seeing AI being linked to: operational efficiency, financial efficiency, clinical efficiency. And then we'll dive into what does that mean from a risk standpoint?
Yeah, absolutely. And just to kind of, I was doing a little bit of research in preparation for this conversation, and the global AI market in terms of, the healthcare space, the global AI market, it's at 36 billion right now. And wow. It is to increase 20x to over 600 billion in the next 8 to 9 years. So these next 1,000 days, 3 years, I think we are going to see more change than we've seen in the past 10 years. And it's going to be accelerated by AI. And just this morning, reading the Wall Street Journal and a couple of other publications, two things stood out to me in terms of AI, just to put context to our conversation here. One, Walmart, the chief technology officer at Walmart stated that AI has already started to impact not just some, but all aspects of the business. So that's one. Google, the CEO of Google made the comment that AI is already impacting all aspects of the business. So I think in the healthcare space, we are at the start of this journey where we will be seeing an impact of AI across, especially the patient care experience and workflow efficiency. I think those are two initial areas. Beyond that, one other thing I just want to put context to this. So when we think of AI, we've got to think of data. And I did not know this, but when I was doing some research in preparation for this conversation with you, Brian, 30% of the data that's generated across industries, 30% of the data that's generated is healthcare data.
Wild, isn't it?
That is huge. And just to put another, I'm a numbers kind of guy, 73% of the technologies that are in play in healthcare are legacy IT technologies. So we've got old platforms and an explosion of data. This is where AI comes in, and I think incredible opportunities in the journey ahead.
I do too. And I think that we're going to see a greater dependency. I think that you're going to see individuals reinventing themselves from a workforce perspective and helping come up with even greater solutions and solving problems and solving a disease as well as care path issues that have been our, I'd say, big gap within the last 20 or 30 years of operations. So I see this as becoming a better healthcare experience, patient-wise, staff-wise, with amazing outcomes because it becomes decision support, right?
Yeah, and AI is already saving the impact in terms of doctors, already saving 20% of their time in terms of administrative tasks and all of that, which means that it frees up the doctor to spend a little bit more time with the patients. So I think it's huge. And just think, you and I know for me, I'm not getting any younger. You look young, okay?
You look younger than me, from the last 20 years. You've done better than me on that.
Well, every time we go to a dentist or a doctor or a provider, our data is spread across all these systems. Just imagine in the future with AI, we go in there and the provider has access to all your data unified on a dashboard, giving a single picture of where you are in your health. Very proactive.
Right. And not having to go through the rigmarole of having to give away all that information or provide the information or fill out all the forms and actually get to the actual cheese, which is, I'm here to see the doctor. I'm here to be taken care of. I'm not here to rewrite my history 1,001 times, right?
Yes, absolutely.
Hey, what are your thoughts regarding, standards and especially guidance for AI management? And are they different here within the US as well as versus globally? And I'm asking that just for everybody who's viewing this. Ali has the wonderful luxury of not just being a core consultant and subject matter expert here in the States, but also globally. He's asked to travel around the world with a variety of dignitaries and assist in their countries' governance, setting up solutions, dealing with risk management, dealing with security issues. And so I know that you're touching this in a variety of different areas. So part of it's a question I know the answer of just because of our connection, but I think that the world needs to hear from you. What's going on US versus everybody else?
Awesome. And I was in Ireland recently, and in the European Union, they have now passed several months ago, the EU AI Act. So just like we have GDPR, which has impacted personal data processing in the European Union wants to standardize how data processed by AI is going to be safety concerns, the trust issue, security governance, all of that kind of stuff. So in Europe, the EU AI Act is huge. Outside the US, the other major standards body that's very significant is ISO. And ISO has developed standards 23894. People can Google this, ISO 23894, ISO 42001. Those are like concrete and steel in terms of if you're going to be doing anything with AI governance, AI risk management, you cannot be illiterate to those bodies of work outside the US in terms of global standards. In a draft state, because just in preparation for this meeting, again, I was doing some research. ISO has another standard that's going to be coming out very, very soon, ISO 27090. It's in a draft state. And the reason, Brian, this is so important, this is the first standard globally that's going to be very focused on AI cyber risk management.
Oh, wow.
So it's okay. Bringing the topics you and I are talking about here, which is front and center to all of us here in the US and outside, is the risk to resilience journey with AI. And 27090, the publication from ISO that will be coming out, I think will be a very valuable reference for senior leadership executives to make sure that their organizations are aligned with it. That's going on outside the US. Inside the US, we are very focused on NIST, the National Institute of Standards and Technology, and they have a standard RMF, Risk Management Framework 100-1, and a sister publication which covers Gen AI 600-1. Both of these are really important. Organizations should be looking to what's a key action item for leadership, the board of directors in terms of initiatives in the next 6 to 12 months. Every organization, small, medium, large, healthcare or outside in other industries, should be performing an AI risk assessment to establish a baseline so you know what your risks are, because only when you have visibility into your risk can you establish the journey to resilience.
Mm. Does that also tie directly into the existing types of consulting engagements that you always advocate for regarding disaster readiness, HIPAA, of course, security as a whole, digital security, physical security, app security, partner security? So this just becomes another layer to that cake.
It does. Okay. It does. So you got to make sure. So an organization, for example, in the healthcare industry, everyone's got to be performing a HIPAA assessment, like you mentioned. Along with that, when you look ahead in terms of budgeting and priorities, need to be adding AI to that HIPAA assessment. So you have those specialized reports that are coming out and they're identifying the gaps. Are you prepared for the risk, or are you addressing those appropriately? And you mentioned your business associates, the third parties. Third-party risk is the supply chain. And so we got to make sure that you may be very resilient, but your suppliers may not be resilient, and that could be a backdoor into disrupting your business.
Yeah, we've seen that before, and that happens a lot of the time, folks. If you haven't looked into that, that's something that ecfirst as well as other providers out there can definitely assist with. So this is a question that's just coming to mind. Does HITRUST certification provide opportunities to assess overall AI risk?
So just to take a step back, HITRUST allows you to assess your state of compliance and state of your cybersecurity risk. So organizations can achieve HITRUST certification, and there are 3 levels of HITRUST certification. E1, as in elephant one, it's an entry-level certification. I1, and then the R2 as in rabbit 2. And so an organization would start initially to achieve the HITRUST E1 certification. And once you've achieved it in year 1, then you could in year 2 say, you know what, I want to add AI to that scope. So you could have an E1 plus AI certification from HITRUST. And the reason HITRUST certification is so valuable is because it gives confidence, I think the 2 C's. It gives confidence to the stakeholders. It brings credibility to your cybersecurity and compliance posture.
That's
so
right.
Highly recommend organizations look closely at HITRUST certification options and opportunities to bring credibility to your program.
So again, E1, I1, R2, your recommendation is individuals that are out there should be looking at HITRUST E1 plus the AI cert.
Yes.
In order to deal with this. So that,
Yeah,
you know,
that's it.
okay,
And it gives you the confidence. So the board of directors is going to be asking the CIO
critical.
or the chief technology officer, how do we know that we've got a resilient posture when it comes to compliance or cybersecurity high trust certification?
You know, I'm going to go off script a little bit here and just ask you something. Are you starting to see a convergence of the CISO, the CTO, and the CIO into like a new position or domain out of this? Because you're seeing infrastructure, apps, you're seeing data, you know, and it's very, all this is strategic. And so it feels like there's a new type of position that's going to be evolving out of this. And that's what I'm curious if you're already seeing that spark.
We are seeing more collaborative efforts that the CIO, CTOs, Chief Information Security Officer have to expend. And I think you're going to see a new role emerge in the next 12 months. I'm more wrong than I'm right, Brian, but there is going to be a role that typically does not exist today inside organization, Chief AI Officer, CAIO. And this is the person,
CAIO, yeah.
it brings together all these important strategic
Mhm.
responsibilities where you got to make sure from a business perspective, there's alignment in the CIO, the CTO, the CISO, and all of that from a business perspective.
I swear, I'm hearing that in our conversation, just with one another, that evolution and that need. And so there's got to be a propensity to somebody actually creating that position and then creating a group that's going to need to address feeding them all the information, education, and creating that uplift. So, yeah, I'm with you. I hear the bell. So, how does an organization assess just themselves? You know, and I know your organization can definitely assess, but how does an organization assess, you know, any current AI cyber risk?
I think
Or
it's
how
very
should they? How should they?
yeah. And many organizations, Brian, are on the fence. They're questioning, what do we do? How do we get started?
Yeah.
What are the first steps? And I always recommend the first step is knowledge acquisition. We got to be more aware of the standards and the guidance documents, both inside the US and outside, to establish our posture, build our policies. So I think it's really important for the organization to create a AI governance posture, establish your AI policy in terms of risk management, and then perform a risk assessment tied into
Mm.
a specific standard. Now, you might say in the US, we are very aligned with the NIST body of work. And so over there, I think it's very important to say that perform a risk assessment tied into the NIST AI RMF framework to give you a sense of kind of where you are. That would be the initial step. So the combination of building your policy on an AI specific policy and performing an AI centered assessment.
Okay. That makes sense.
Yeah.
The key though with that is making sure you have the assets and the resources that can actually do that, right?
Yeah, and they understand the standards and the guidance. We see a lot of organizations that just don't have the appropriate knowledge. So I think that first step is acquire the knowledge, understand it, and that's where, Brian, what you are doing and what we are doing in collaboration is the certification training programs, you know, when it comes to AI. So we have a brand new program, AI CRP, the AI Cyber Risk Professional that we've
Yeah.
launched, which is to give that introduction to the AI risk management space.
And you feel that this will also be of assistance to those careerists who want to be within that new role that you just pronounced a few minutes ago, because there's got to
Yes.
be a stepping, into those types of careers, especially from an enterprise perspective.
It would be because you're beginning to now acquire all the AI fundamental knowledge to position you to have those conversations at the next level.
Okay. All right. Well, let's go on. Let's look into the section that's entitled Beyond HIPAA Compliance. You know, what's the future got to hold for us? So thank you, Ali, for talking about the AI piece. Extremely eye-opening. I'm not kidding you, regarding not only the risk but the risk management. But now let's turn to the foundational issue of HIPAA compliance. And as we know, compliance is just the baseline. Many organizations are always aiming higher to build true resilience. And so what I'd like to do now is explore what it means to go beyond HIPAA compliance, kind of in that Superman motif that's happening right now with everybody. What should organizations be prioritizing to address HIPAA compliance as well as AI risk management, playing upon what we just did?
Really good question. First of all, to take a step back, when we talk about HIPAA, and you're right, HIPAA has been around for 20 plus years. And so when we talk about HIPAA, it's many layers of regulatory mandates. HIPAA privacy rule, HIPAA security rule, high-tech breach notification, HIPAA final rule. But in the last 12 months, OCR, Office of Civil Rights, has been enforcing HIPAA more than ever before. A lot of HIPAA settlements taking place, a lot of fines and penalties associated with HIPAA. So when to use your language, beyond HIPAA, got to make sure that organizations are looking very closely at OCR enforcement for HIPAA to understand where is the bar for HIPAA that the organization needs to set. That's number one. And what are the industry best standards? Now, one state in particular stands out right now, and it's the state of New York. And I think if we are looking at the future of HIPAA, we got to look at the state of New York. And the reason I bring out New York is because New York Department of Health has introduced some more stringent requirements for healthcare organizations, hospitals, health systems that they must be in compliance with. And Brian, let me give you one small example. In HIPAA, if there's a breach, you're given 60 calendar days to report that breach to the OCR organization. With the state of New York, you have 72 hours. So you can see where we are is 60 days of notification. Where we need to be is 72 hours. That's a big leap. And that's what organizations, as they look to 2026 and 2027, have to re-engineer, reimagine their HIPAA compliance program. And I would strongly advise the future is with what we see in the state of New York. Use that to elevate your HIPAA compliance program. The other states are going to be following.
It's so strange for you to say all this because what the public doesn't know is that Ali helped Mindy Hatton, Lawrence Hughes, Ross Schulman, myself, and a few others at the AHA in advising us on how to actually shape HIPAA when HIPAA was actually being formed. And so you have the advisor in front of you right now, folks, who's also now telling you that this thing has got a quantum leap. The quantum leap is we're not playing around with 60 days anymore with reporting. We now got to jump it fast into 72-hour reporting, which seems like an impossibility, truthfully.
And that's where you need AI capabilities integrated in your organization because you cannot report if you don't know. So you got to detect these attacks taking place a lot faster in real time or near real time so that you're able to identify that this is the incident that has occurred. It may be a breach, analyze that, and then report it to the appropriate authorities.
So you're telling me, and just for my sake, that we can use AI to help us in detecting, reporting, and also combating these security issues.
Absolutely. And I think without AI, it's going to be very, very difficult. So this is where the three topics that you touched on at the start of our conversation, AI, cyber, compliance, it's a fusion. And we've got to make sure we are leveraging AI appropriately, integrating it in our compliance programs, and having an impact in the cyber defense that we are going to be implementing inside organizations.
That's great. So I'm going to ask, what is the state of HIPAA enforcement and fines currently, regarding compliance by OCR? And do you see that ratcheting up per the use of AI or lack thereof? AI, I mean, it becomes an incentive? Because that's what I just heard. So I'm wondering.
So just 24 hours ago, there was the 14th OCR settlement just in one narrow area, ransomware attacks related to HIPAA compliance. This is the 14th one. OCR has never been this active in terms of HIPAA enforcement that what we are seeing right now. And I think for organizations, I always make the time to read the resolution agreement because that's public information to understand why did OCR audit? What was the deficiency? What is it that this healthcare organization did not do that they should have done? And so I would encourage all the viewers listening to this conversation to take a look at the OCR resolutions, especially the ones dealing with HIPAA compliance and ransomware, for example, to get a sense of what is it that OCR is expecting in terms of HIPAA compliance. And really, in order to meet those requirements, the organizations are not going to have a choice but to integrate more AI capabilities and enable those across the computing ecosystem.
Tremendous advice. Tremendous. And you've opened up my mind just in thinking how we can actually utilize AI for bettering the organization, strengthening it from a cyber resilience perspective. Okay, so we closed on the high trust question last time. Let's do it again for this section. What about high trust certification? Can it address HIPAA compliance?
Yes, so high trust does specifically provide support for all of the requirements inside HIPAA. So I gave you an example earlier of the E1 certification from HITRUST. You could add HIPAA to E1, so it would be an E1 plus HIPAA certification from HITRUST, and all of the requirements that are related to HIPAA would be included in the HITRUST certification for E1 plus HIPAA. So the short answer to your question is absolutely. I think it's very important healthcare organizations take their HIPAA compliance program to the next level by achieving HITRUST certification.
Okay, but I heard in the last portion of our conversation, and I'm not fighting you on this, but we should do E1, and I'm showing you I listen, E1 plus AI. Right. But now what I'm hearing is you can do E1, I was getting confused here, E1 with the HIPAA piece.
And you can add AI to it as well.
Well, that's what I was wondering. So, yes. You're hitting it out of the park now. So that's why I was curious. Okay, so that combination is a winning combination.
It is a winning combination. So and I think I always recommend organizations start slow, keep it simple, don't complicate things. In year one, set the goal to achieve E1 certification, and then year two, what you could do, Brian, to what you just said, add HIPAA and add AI to that. So by the end of the 24-month journey, you've achieved HITRUST certification that covers AI, that covers HIPAA as well.
It's been a wake-up call, seriously, and I appreciate that immensely. All right, so a strong compliance framework is essential in that HITRUST certification could be a powerful tool in that process. But even with the right policies in place, we know that healthcare organizations are still vulnerable to cyber attacks. So I'm now going to transfer us to the cyber threats and ransomware disruption. So ransomware can be completely an operational death sword, and it can bring it to a complete standstill. And we're seeing that throughout the marketplace. We hear about it on Beckers all the time. Let us talk about this topic that is extremely vital for organizations within the healthcare community to understand, as well as just plan for. And then I want them to walk away from this portion of our conversation on not only how to defend against cyber threats, but also transform that organization's risk policy and action into complete resilience, or at least start it. So that's my aim and ambition with this piece. So if you don't mind, Ali, give us a sense of the scope of the threat. Why don't you begin by talking about ransomware disruption within healthcare and other organizations, and what does that mean? How is it affecting them? What's also been the outcomes and learnings? Because as you said, you get to see and read about this each and every single day.
Yeah, and we hear about ransomware, and unfortunately, it's a risk that we've had in the past. It's a risk that we are surrounded with right now. It's a risk that's going to be with us in the future. I think the key thing to remember about ransomware is that it encrypts data. Healthcare patient records is encrypted, and we don't have the decryption key to that data. So we can no longer get access to patient records that we so desperately need in order to provide care. So that's the reason at the heart of the healthcare industry is patient information. And if that data is attacked as a result of a ransomware event that takes place, the organization now has to go to manual processes.
Paper.
And that's just impossible in today's day and age. So that's why organizations have to be really, really prepared. And the NIST, I mentioned NIST as an organization that has guidance and standards documents that they've published. They have a beautiful work that they have published a couple of years ago, NIST IR 8374. And the reason I bring that to everyone's attention is because this is very focused on ransomware readiness. What can an organization do to be prepared to deal with the threat of ransomware? And so this provides the guidance that organizations should be following. There should be an assessment. There should be a ransomware readiness program that an organization puts together. And then really important, equally, Brian, is the fact that an organization should run tabletop exercises. They should run exercises to determine what's their most valuable application, what's their most valuable data. And if something were to happen like a ransomware attack, how can they rebuild that platform within the next 24, 72 hours so it's predictable, it's defined. Organizations are looking to have redundancy with alternate data centers or redundant data and alternate cloud service providers. Those are things that should be done before a ransomware event, not after one.
Right. Yeah, those a lot of those elements that you just stated are elements that you and I were promoting, literally years ago.
Yes, we were.
I think one of the things that we're going to need to do off of this too is we'll offer these links to NIST 8374, for example, to the individuals after this call too. What would be some of the additional steps that you would also recommend? You mentioned some, but are there others that an organization could undergo? Better yet, let's say I have a team of individuals that are in my data department or my IT department, and I want them to get the best knowledge around this subject. Where would you tell them to go besides Google?
Yeah, I mean, I think the NIST platform, the NIST standards organization provides excellent reference materials. And like you said, after this, conversation, we can provide some links to enhance. I think the two areas that I think it's very important for IT professionals to learn more about and master, one is business impact analysis. Business impact analysis. So if there were a disruptive event, how do you recover from that? And the other is to make sure that organizations put together a credible IT disaster recovery plan with a more strategic business continuity program, what is referred to in acronyms IT DRP, Disaster Recovery Plan, and Business Continuity Program, BCP. And again, NIST has a really good reference on this topic that I just mentioned, NIST Special Publication 800-34. If they Google NIST Special Publication 800-34, they will find examples of templates and the different phases that an organization has to make sure it is prepared in order to make sure they're resilient to ransomware attacks.
I appreciate that. And because it gets people on the right path. That's why I said I really want folks to have that capability of having a springboard off of our conversation to start to work. The other thing I'm going to say, and he won't do it because he's too humble, but I will, and that is have all your folks look at his site, which is ecfirst, because the education and the training on it will enable your team to gather not only the facts, the figures, the data points, but also the best practices, the standards of how you should actually address this. So next question I have for you is regarding the Office of Civil Rights, OCR, right? It enforces HIPAA compliance. Have there been any OCR fines related to HIPAA non-compliance as a specific result of ransomware attacks? And what's the size of something like that, if I may ask?
Yeah, so these fines, there have been several, over a dozen OCR resolution agreements very specific to HIPAA non-compliance tied into ransomware attacks. And these fines typically vary from about $250,000 to $2 or $3 million. But those fines really, Brian, reflect the tip of the iceberg, because typically anytime there's an OCR settlement that takes place, there are two components to that settlement. One is the actual dollar fine that you have to pay, the monetary impact, but then you're under oversight by OCR for at least 2 to 3 years, what they call the corrective action plan, where you got to be providing quarterly reports on your HIPAA compliance program. And that the cost of maintaining that corrective action plan for a 2-year, 3-year program could be many times the original fine that you're paying. So I think organizations should be looking very closely. If you go to hhs.gov, the Health and Human Services website, and just search on HIPAA, you will see the list of all the fines over there from OCR. More important than the fines, I would encourage the viewers to look at the resolution agreements, because the resolution agreements tell you what you need to do to comply with HIPAA moving forward.
That's great advice, and I appreciate that. I appreciate you giving that free wisdom to everybody who's listening to this and watching us. So let me close out now, and we'll do this again, I promise you. But I want to thank you personally for all of your deep experience and your knowledge and your wisdom, and most importantly for helping us better understand this evolving landscape and taking care of us too, because you're giving us the free consultative advice in order to start addressing these things, and that means the world to me. At WellLink, folks, we're excited about our partnership with ecfirst. It's great to be reconnected to my dear friend. Together, we're committed to empowering healthcare organizations with the tools, the frameworks, the strategies, the training that everybody needs in order to just thrive securely within this new era. And to learn more about ecfirst and the comprehensive cybersecurity solutions, we've got a link that's going to be attached to this. We promise we'll put the other links as well, but we just want to say thank you for taking the time to view us, maybe even get a couple of laps in as well. And we'll start sending you some more content as well as videos as we progress within this overall strategic relationship. So thank you,
Brian,
Ali.
Thank you, Brian. I cannot thank you enough. You're a visionary in this space. Been following you for a very long time. Our friendship for over 2 decades has been priceless, and I'm really excited about the opportunities ahead, especially with AI fueling. I think this is our moment. This doesn't come too often in a generation, and we got to seize the moment.
Yeah, I want to say thank you to you and give you some gratitude. I was one of Ali's first individuals that went through his CSCS program. He still has it today. And I'm going to tell you folks, these programs, they've got some meat to them. I mean, they're thorough and they're tough certifications to accomplish. But what you walk away with is a basic understanding that will translate into tremendous value for you as well as your organizations that you all represent. And Ali enabled me to have some of that. And I just wanted to say thank you, friend to friend on that. So, thank you. So again, pleasure.